Bonsoir.
Well, good evening. I'm here to talk about my third reincarnation, or my third life. My first experience was at the International Work Office. I was responsible for health insurance at the world level. And I had a number of customers, ministers mainly, who had three questions that they kept asking me. Unbelievably, they were standard questions. Come and help us create a work code. Come and train the people, and please come with money. And maybe that way, I went to some 35 countries where we created a dysfunctional health system. It frustrated me at a very high level from a personal point of view, and it kept me bedazzled. How can we help people through such system which people think are providing solutions, but they're not? So that was my first life. My second life was at university. I was teaching life economy because, well, I had some knowledge that I could bring across. And I also conducted some research at the grassroots level, and notably in India. I didn't pick India. It was a bit by chance. India also chose me. And after that, my third life started. I came across circumstances during which I was overwhelmed. Reality was stronger than me. It was completely different from all the theories that I thought were right and what I think was the right solution to those issues. It is true that I had the actuarial formula to the actual algorithm to compute a price. I knew how to measure health in quantitative terms. But the reality in the field is completely different. It is not a matter of disease. It is not a matter of mortality or morbidity rate. It is a social issue, which brought me to challenging everything that inspires me. I was an international public servant first. It was a good job, but the idea that I had at that time was to, in my own way, change the world. That was very that was a very ambitious objective, but I wanted to try and improve the situation of less lucky people. But then I had to change this inspiration. I had to change this objective because it was not sufficient. It was not powerful enough. I found my inspiration with Mahatma Gandhi. I cannot translate it into French, but the Mahatma Gandhi said, "The greatness of humanity is not in being human, but in being humane." And this is indeed very difficult to translate in French because humane and humane could be humanism or something around humanism, but basically it is a way to go beyond yourself, beyond your human nature, in the humanitarian project. The other inspiration comes from the Xhosa people. I am because we are. And it is not Cartesian, is it? I have an existence, I have my own life, but it is nurtured by the life of my community, the community I belong to, the community I was born into. And with those two motto, I had my new inspiration, and it really strengthened it strengthened my inspiration. Next week we'll have the General Assembly in New York of the United Nations to adopt. We know that for sure. We will adopt the new decisions on the Sustainable Development Goals. There is an unbelievable number of goals and indicators and targets which you could rightly judge in a very skeptical manner. I'm very skeptical about them. I know the Millennium Development Goals. There were only 7 of those, and it was already very ambitious, and it was already very difficult to meet those targets. But the basis of this unusual mission, the rationale behind the way the UN works is from government to government. International conventions, money going to governments, and government ruling that play. There's nothing at the level of the country itself. There's nothing at the level of the last village. A group challenged this and said, well, that's too much. We cannot meet all those objectives. So there was a meeting of some 30 Nobel Prize winners, a number of very prominent first-level persons. With $500 million, what would be the single theme on which you would insist and put the high priority? Not 17, not 100,000 objectives. And that group of prominent people could reduce that list down to 19 objectives, which I find quite a very high number, and it's still very complicated. So 19 is definitely less, but 169, I will grant you that. But 19 is still a high number of objectives. And if you have a closer look at the cost, it costs a lot of money, which I have no idea where we're going to find that money. And again, it will be budgeted, it will be money going from governments to governments. But if we have a look at other solutions, we can tell that there is a momentum here in order to create public-private partnership, this link between the governments and the business world. And today, we listen to speeches by people from the business world when they say that it is high time for the businesses to be accountable, to be responsible in terms of the environment, for the corporate social responsibility. So it's no longer G2G, G2B, and B2B. And in the face of all this, with all the inspirations that are mine, I'm going to tell you what is my priority. That will be P2P, people to people. And why say? Because 4 billion people on a daily basis prove that they have no relations with the governments, that they do not trust businesses. And without that trust, without that connection, you cannot move forward. So we need to see how we can make headways in the villages, at the villages level, so that people believe and accept and be committed and be part of a positive economy. I have little time, so I'm going to give you my 3 take-home messages that I would like you to remember from my speech. The first message is the following. The risk, which is not insured, because, I've been focusing for years on health and risk, on health risks and other risks, but also, agricultural risks are no lesser risks. The risk on cattle, the risk of accidents. I work in Nepal after the earthquake. There is also the risk of natural catastrophe, to name only by a few. There are very many of those. The non-insured risks are, in fact, the main cause which obliges people in the informal sector, in other words, people who have no connection to their government, to be in the entire world exposed, whether they want it or not, to poverty, to poor health and uncertainty. This is a major challenge. Have a look at what happens in Europe. today. Well, the figure changes, but there are some 800,000 people who live in uncertainty. Not all of them are in ill health or poor health, but those people do not want to live in uncertainty. Let's just envisage 4 billion people who live in an incredible dire poverty. I live with people who live 56 cents per day. So it's less than half of what the World Bank defines as the absolute minimum threshold of poverty. And I live with people who earn less than half of this. If we want to if we want to deliver people-to-people insurance solutions in the informal sector, we need to innovate in business models and the way we think about social engagement. You know, you can come from the outside. You cannot have this top-down approach saying, you know, I'm a university teacher. I was a civil servant at the world level, at the international level. It will never work. You know, for people at the grassroots level, for people who live in those villages, the world is limited to their village. They know in their village who they trust. They know who they do not trust, who's poor, who's rich, who is maybe not food poor, but cash poor. Because there are different nuances, you know, in poverty. There are different nuances that you miss if you're not aware of such subtle differences. And obviously, there's nothing we can do, either whether we organize an international conference in Geneva or in New York. You really have to be in the villages and spend time there, not only one day. You have to spend time in those villages to create and deliver a solution which is sustainable. The third message is about innovation. Innovation for people who live in rural areas, in poor countries, which means 4 billion people. So we need to recognize their weakness, because we talk abundantly about weaknesses. We have to recognize their weaknesses, but also their strengths, their capacities. They have resources. They have local resources. They have time. They have talents. They have money. The money we don't know. They have their social mechanisms. And if we miss that, if we have this outside perspective, if we do not recognize the comfort they have, if we only focus on their weaknesses, it's like charity work only. And what we know about charity is that it's a disease, it's a contagious disease, it's a donor disease. Charity is a donor disease. Nobody wants to continue and do charitable work for a lifetime. So it is impossible to find a solution if we do not involve people and get them involved in the design of a solution. What we've seen by working at the grassroots level is that if we want to work with people, you shouldn't bring them a ready-to-use, an off-the-shelf solution, or give them money and tell them, okay, now we bring them a big fat envelope of money, you do whatever you want. First of all, what you need to do is capacity development. People are able to do. Nobody's born with skills. Nobody is born with the knowledge to do insurance, neither in Paris nor in Vincale. So you need to learn and to get the message across. This needs to be translated in local language with local pictures and local images. And this must be created, this must be paid. But this is not charity, because you just take the social mechanisms, you take the local skills, and you include them in the in the solution designing process. If we want to create a mutual health insurance system, a private health insurance system in a village, we need the villagers to put things in common. It's impossible to come and impose fixed ideas, saying, well, that worked very well in France, that worked very well in Germany, so it's going to work in your village. No, it doesn't work. You know, for those people in the villages, Rome is very far away. Even if they are Catholics, Rome is very far away. So we need really to tailor to the local structure if we want a solution to be successful. And then third key to success is governance. Many people have talked about trust. Now, the main question is, people know who they trust. They also know who they don't trust. The first people they don't trust is the government and business owners and everybody coming from the outside and they don't know their background. When you know that basic rule, then we can use it to improve the situation in the village. And then that will be, those are the three keywords. It costs money, but it's not the same thing as trying to bring help, which costs billions or even trillions, and which we can challenge, because when we bring that much money, it's not going to necessarily to work. We also know what gets people to ask for help, but I do not have time to develop this. So obviously you can come to the Meet the Speaker session and I will tell you more about this. So what's the future? We have, that's the vision for the future. We have a new sharing economy, which is not Uber, which is not Airbnb. It's a different collaborative consumption model or scheme, which can be created because we've done that in hundreds of villages in India, in Nepal, in other countries out there. You need to be patient. You need to give that, you need people to believe. This is not going to happen overnight. And the potential is tremendous. There is an impact, a positive impact on financial security, but also on it also makes people safer, and they will be more eager to take risks because there are risk insurance schemes which are available out there. And before I stop, and this will be my last words, I would like to thank you, the audience, for being here. You're still here at this very late hour, so it's very brave. Secondly, I'd like to thank Jacques Attali and the organizers for inviting me. I arrived directly from New Delhi yesterday evening. I'll be back there in a couple of days. I would like to thank you to give me the opportunity to share a bit of my experience, personal experience. And finally, I would like to thank you for sharing this hope, because we've seen a number of failures, and those failures are not models for the future. We need to find new models. Thank you.